So you may have heard this before, maybe another video, this concept of restricting calories and living longer. There's been a lot of research in this on animals, insects, bacteria, and yeast, and mice, that if you actually cut their calories, they live longer. But that conflicts with all the people that have done low-calorie diets in the past. It's been proven that the more you diet and you lower your calories, you end up gaining the weight back, becoming bigger, and really struggling to stay on any diet. And not only that, it destroys your metabolism over time. So how could the restriction of calories end up making you healthier and live longer? That's what I want to talk about. So a couple things. Most of the studies out there were done on animals, not humans. There have been some studies done on humans using the fasting mimicking diet, where you're doing meals that are 500 calories a day. There's also a program out there called 5 and 2, okay, where you can pretty much eat what you want 5 days out of the week, but 2 of the days you're consuming 500 calories per day. So you're restricting your calories. So there are a couple problems with this, and there's some problems with this as well. When you do the fasting mimicking diet, you're not doing this for any period of time. You're doing it for a short period of time, and then you're off of it. You're going back to it like a diet, which I don't agree with, because what happens when you're not fasting, you can pretty much eat whatever you want, and that is something that's not very workable. The other big problem when you lower calories is, what are those calories made up of? If you're doing low calories but higher carbs, you're going to keep your blood sugars up and down, up and down, up and down. So you're going to be very hungry. You're going to actually be very uncomfortable. You're going to be very weak. You're going to be very irritable. Okay, I've done these diets before. The only thing in my mind is that big pizza I'm going to consume as soon as I get off the diet. And then you have people that do low calorie and they're doing it with low fat. That is going to stimulate a lot of hunger. Again, very uncomfortable, not sustainable. And this is the real big problem when people go on diets. Blood sugar issues, hungry all the time. You're going to binge, you're going to go off the program, you're going to then eat the wrong foods, and you're going to do this over and over again. And every time you do this, you destroy your metabolism a little bit more, a little bit more. So let's talk about the real benefit when you restrict calories. The real benefit is epigenetics, okay? Epigenetics means above genetics. So you have a certain amount of genes, and then you have the things that trigger these genes. It's called expression of a certain gene. And the genes that affect longevity and weight loss have to do with really lowering your glucose and your insulin. These are the two powerful triggers for the benefits of the calorie restriction. Not the fact that you're restricting calories, but that you're restricting glucose and insulin. This is where the benefits come from right here. The other big problem I see when people do low calories is they lower their nutrients and they create nutritional deficiencies. And especially if they do it long term, they end up with all sorts of problems. But if you're new to my channel, this is what I recommend. I do not recommend trying to restrict your calories. I recommend restricting your glucose, and that will indirectly lower your insulin. So a low-carb diet, very, very important, but not a low-fat diet. So you want to increase your fat, moderate protein, lower your carbs. What will happen is your body's going to now shift. It's going to shift its metabolism over to fat burning. Your hunger is going to go away. It's going to be very easy to do. You're not going to have the blood sugar issues. Why? Because your carbs are low. It's really about keeping your carbs low and keeping you in fat burning. It's going to be very comfortable and even pleasurable when you're able to tap in your own fat because your hunger goes away. And this makes it sustainable. So instead of going low calorie or doing a 500 calorie meal, I recommend you do intermittent fasting, okay? So you're going to try to go without any food as long as you can, okay, until you're hungry, and then you're going to eat. Why? Because that's going to help lower insulin, okay? And when you lower insulin, all sorts of things happen on the epigenetic level and the genetic level as well. You're definitely going to live longer. You're going to have a lot of health benefits. And when you go from 3 meals a day down to 2 meals a day, down to 1 meal a day, you're naturally going to lower your calories because there's no way you're going to be able to consume what you would consume in 3 meals in 1 meal. But it's not the fact that you're lowering calories that makes the difference. It's this right here. Don't focus on calorie restriction. Focus on healthy keto, which is low carb, higher fat, Focus on nutrient-dense foods so you have no malnutrition, as well as infrequent eating. So this way it's sustainable, you can do it long-term, it'll be comfortable, you won't be hungry, and you feel good. Thanks for watching. Hey, if you're liking this content, please subscribe now, and I will actually keep you updated on future videos.